Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Well, hello, and welcome to Seven Figure Chiro Podcast. I'm your host, Dr. Jeff Berard. I'm along here with Kristin.
Hello.
Hello to everyone. So today's episode is exciting. I know every episode I say this, but this is crucial. This is by far the most important aspect of your practice to nail, and that is the first visit. Now, a lot of chiros have been to these seminars and these consultants where they give you this first visit thing where it's all about, setting up the patient for a day two and then give them this hard sell. Nope. If that's what you're looking for, you're on the wrong podcast. What I'm going to share with you is how you deliver an extremely strong, evidence-based, super impressive first visit where that patient leaves confident, knowing that you're competent to deliver what they came for you to deliver. That's the premise of this episode here. So, how a seven-figure chiropractor sets up a comprehensive, trust-building, and results-driven first visit for long-term success. So, I'm going to share exactly what we do in our office. Our prior episode, obviously, and by the way, this kind of parlays into, the obsession with client experience. This is what it's about. We talked about our last episode about the details, the front desk, and, what your office looks like, and, dress for the job you want, not the one you have, dress to impress, right? So this is the same premise here. I'll share a quick story. Kristin and I go to the Mayo Clinic. We go to this executive exam where a lot of executives from all over the world go for this exam. It's a 3-day exam. They're very organized. They're very detailed. They're very thorough. They know that their clientele has very high expectations. The exams are expensive. But when we leave there, we don't feel like we were gypped. We felt that we got exactly what we came for and we'll be back. So that's the experience that you want to deliver. I sat down with the primary care doctor, which was my first visit in this exam, and he sat down and talked to me for 90 minutes. He asked me, none of it was clinical. He just asked me about me. He wanted to learn about me, learn about my lifestyle, learn about my wife, my kid, my mother, my father, my brothers, my sisters, where I've lived my whole life. What kind of lifestyle did my family live? I mean, at the end of that visit, he knew who I was. And he also shared information about himself and created this connection, this commonality that the doctor had with me. And I left there knowing that that's the guy I want to see next time, right? That was a great visit. And he didn't even touch me. He didn't ask me anything about my health. He just asked me questions and learned about me. So do the same, right? That's so important. And we struggle with it a little bit in our office with associates, is getting them to learn that, is you have to build a connection and a relationship with the patient. Don't rush that, because if you rush that, trust isn't built. So that's kind of the premise of this. I just wanted to share that experience that I had, and I was so impressed. And it was that first visit. It was the first impression I had of the doctor.
I do want to clarify, though. They did do a physical exam on you.
Yeah, and I'm not saying they didn't. I said before any clinical, that visit, he got to know me, right? He got to know who I was.
Yeah.
That visit, that 90-minute visit, about 10 to 15 minutes was an exam.
Yeah.
Right? The other 60, 70 minutes was just conversing with me and getting to know me. So important. And that's a testament that is the most important part of that first visit, is to listen. Listen to the patient. They'll tell you what they need and what they want. You have to listen. Don't just rush what they're saying so you can tell them what you want to say. Listen to them. So how do we do it in our office? Number one, patient comes in. Obviously, they encounter with the front desk. They fill out all their information. I have a new patient advocate, a CA. If you don't have one, it could be you. That person, that team member in our office, gathers data. This team member, the first visit begins with one of our team members gathering this essential data. So they'll bring them into an area where we gather this data, and this data is like a movement assessment, so range of motion, right? In order to do a thorough exam, you need to quantify their range of motion. And we have some technology that allows us to do that. It's really cool. And by the way, if any of the stuff we talk about, you want information and links how to get, I'll give it to you. Just go to sevenfigurechiro.com and we'll give you any information. But we have this really cool camera that's programmable, right? You can program movements in it. So we have these cervical range of motion, thoracic, lumbar, hip, shoulder, all programmed in the camera. The patient goes through these instructed movements and it quantifies their range of motion. It is amazing, and it gives a detailed report. We upload that report. Our team member will upload that report into the exam. I don't need to do the range of motion exam in the room, although I do it. I just don't quantify it because it's already quantified. Pretty impressive. This patient comes into the room and we do a thorough range of motion check. Once they're done with the range of motion check, they go in and they do a gait assessment. So we have them walk on we have an orthotic system. We don't have these BS orthotic systems, by the way. We have a very, very good orthotic system where we check them statically and we check them dynamically. And as we're doing that, we educate them on why we're doing that. So this, again, just packs a punch with a thorough evaluation and exam. Once we have that information completed, they are taken into a treatment room. In this treatment room, this team member again reviews the intake that the patient filled out, and they finish collecting the patient history, family history, gathering both past and present health history, understanding how their family issues, sharing with them how their family issues may influence their current condition. So all that stuff is gathered. We have the patient at that time. I don't do this, a team member does. At that time, the patient is given an outcome assessment form that correlates to their presenting complaint, and we tell the patient the reason why we gathered the range of motion data is because we have intention to measure improvement. We expect improvement, and we measure that on a regular basis so we can quantify our progress. The reason why you're filling out this outcome assessment form is the same reason. We want to know where you are today so we can quantify improvement on our reevaluation. This instills in the patient that we're actually going to and intend on improving this patient by measuring the results. How many of you do that? Ask yourself that question. You can't tell a patient they got better if you don't measure it just because they feel better, right? That's one metric, but it's not a quantifiable metric other than the VAS scale. So once all that information is gathered, the outcome assessment is done, the gait assessment is done, the range of motion test is done, and the patient's history, family, past, health, surgical, all that stuff is completed by my team member. Then I am instructed to go into the room, and this is where the transition from the data collection to meeting the chiropractor and establishing a rapport with him begins. And this is where the real connection begins, right? How the chiropractor listens deeply to the patient's story and concerns. So I shared with you my story about the Mayo Clinic, and I've always felt like I've done a really good job of this, but I know a lot of practitioners, they're just straight to the point, cut right to the chase. They don't care to know anybody, and I think that's a big mistake on building a legacy practice and really gaining the trust of clients. So take some time to just meet the person, right? I know we're all rushed. If you don't have enough time, then have longer exam times. I promise you, if you delegate longer exam times and establish that relationship, it's going to make up for itself on the back end. Like, oh my gosh, I can't give an hour for an exam. I don't have time. I see too many people. Well, I guess quality isn't important to you. I guess, being obsessed with patient experience isn't important to you, and it should be. So take that time establishing that rapport. The purpose of doing this is not only for them to get to know you and you getting to know them, but it's for you to really listen to these people. And if you truly listen and are not just rushed to get done and out of there onto the next, they will tell you exactly what they want. They'll tell you exactly how they want it. They'll tell you what makes them happy. They'll tell you what they can't do because of their problem. And then you have a roadmap on what to deliver to these people and to satisfy them. So listen is extremely important. Don't just rush. So once all that information is gathered and I have an understanding of who this patient is, what they want, what they're all about, they know a little bit about me, I'll go in and explain to them my health philosophy. I call it the health triangle. And, my health triangle, there's a couple out there. You can create your own. There's chestnut, Dr. Chestnut. I always liked his, how you eat, move, and think, right? That's a health triangle. There's another one that is structure, function, and lifestyle. Create a health triangle so you can explain to the patient before you examine them what your philosophy is, okay? And that's what I do. I use eat, move, and think because I think it resonates with everyone. A lot of us are stressed. A lot of us don't eat congruent to how humans should eat. And a lot of us don't move. And I think those three areas greatly affect our health. So that's what I talk about. And I ask them, eat, move, and think. I'll say, hey, Kristin, tell me a little bit about, what's your diet look like? How do you eat? Tell me what's good about what you eat, not what's bad, what's good about what you eat. And, we learn a little bit about them. How about exercise? How do you move? Tell me a little bit how you move throughout the day. And do you move with intention? Do you exercise? Do you have a laborious job and so forth? And, get information from them. And then go to your third angle of your triangle is, do you live a stressed life? Are you stressed? Do you consider yourself stressed? And, they open up and they learn. So think about all the information you can gather when you share with them your health philosophy and you ask them about those three prongs. Really important. Once that has been established and they understand your health philosophy, they're going to better understand your recommendations when you figure out what their issue is. Okay? So a health triangle, I think, is important to articulate to your clients so they understand your healthcare philosophy. Lifestyle connection, right? Asking the patient about their lifestyle habits. That kind of goes into what I just said, about exercise. If they, I exercise, well, ask them about it. How often do you exercise? What kind of exercise do you do? How do you feel after you exercise? Ask them those questions. Talk to them about what they have for breakfast in the morning, what they typically do for lunch. These are things that allow you to really, really get to know the patient. And this also establishes trust by the chiropractors demonstrating to the patient or the client their genuine interest in the patient's full health picture. And again, this is part of the educational process. So once this has been established and I'm ready to get into the exam, I go over one last thing. The reason why I do this one last thing is as chiropractors, we really need to put a lot of emphasis on building trust and evidence-based practice because there's a lot of people that come into chiropractors that are skeptical. So what I do is I tell the patient, listen, we base all of our care off of evidence-based research. Here in this office, we call it the Guyton's Guide to the Physiological Healing Process. The healing phases. This isn't something that I created. This is something that science has created in research, and it's found in every physiological book when it comes to healing. And there's 4 stages of healing. There's an acute phase, there's a subacute phase, there's a chronic phase, and a remodeling phase. And there's some others in more detail, but we can go into another time if we need to. But each one of these phases requires a certain amount of time. And our job here in this exam is to figure out what phase you're in so we know how much time you're going to take to heal. Do you understand that? And they'll say yes. Okay. So how this guide aligns with evidence-based practices in chiropractic care is important for us to explain, and why understanding the healing process helps the patient stay committed and motivated. It's because this is what research and science shows. It's not because we want them to come back and back and back. This is how long your condition takes. So important to establish. Okay. So now we're ready for the exam. So what happens during the examination? Well, of course, I'm not going to teach how to do an exam. Chiropractors should know how to do a thorough exam. So we complete a thorough chiropractic, orthopedic, and neurological exam, and how each part of the exam ties into the overall assessment. When I'm doing a chiropractic exam, I talk to them. I think out loud while I'm doing it, and I'll tell the patient, hey, I'm going to think out loud, just I can share with you my thoughts. Orthopedic exam, when I do orthopedic tests, I tell them what I'm looking for. Okay, I'm going to do this empty can test. If this test positive, it could be suggestive of a supraspinatus tendonitis or perhaps a labral tear. Just I kind of go through, so when they do come up positive, boom, they've, and a little alarm goes off in their head. So again, important, ensuring the examination is thorough and objective. Reviewing imaging and evidence. So after we go through the exam, if they have prior imaging, I like to see the images myself. For those of you who aren't proficient at it, maybe look at the report. I like to look at both, and I tell the patient that. If I feel the patient needs imaging, I will take them. If I feel they don't need imaging, I won't take them. We don't do images on everyone. We do a lot of images, but not on everyone. But I like to see any image that they might have prior, and how that objective evidence is integrated with the physical exam findings to create a well-rounded picture. So when we look at those images, we correlate the findings on the image, obviously with their exam. You guys know that. That's a basic examination process. So once we gather all that information and we go through a thorough exam, we come to diagnosis and treatment recommendations. Right? So evaluating all the data that's collected, the range of motion, the foot scan, the exam, the objective findings on imaging if we have, right? We pull all that information together from the exam, the imaging and all that stuff. And what does this comprehensive data tell us about the patient's condition? And this is where we really want to provide gold standard treatment recommendations. So we provide them with a very clear diagnosis with a high level of specificity. Really important, and I'm big on that in my office, is for us to accurately diagnose the patient, not just a generic low back pain, neck pain, segmental dysfunction, right? I know there's standards for insurance, and that's great. You can have those, but be extremely specific to your diagnosis. So when we diagnose the patient, that's obviously documented in the diagnoses in the chart. It's documented to the patient. We tell the patient what they get. There's so many times I see patients that have been elsewhere and I ask them what they were diagnosed with and they have no clue, which baffles me. So provide a diagnosis. The next thing, reporting and communication. So you've come to a diagnosis. How do we report that and communicate that? So we send a detailed report to the patient with all their diagnoses, an explanation of what those diagnoses are, their visit frequency, home exercises, and lifestyle changes are communicated to the patient via email. We send them a detailed report. Again, if you want to know how we do that, please contact us at sevenfigurechiro.com and we'll do that. And we also share that report with their primary care providers. The collaboration with the patient's primary care physician. Why and how the treatment plan, that is sent to the primary. That builds trust with the primary. So not only do you grow trust in the patient, but also the primary. We get a lot of referrals from primary care physicians for that one thing that we do. So I want to encourage a team-based care and communication for better outcomes. You know, your team needs to know all these things. They need to know in intricate detail what you do during your exam and why you do it. So the communication with the clients and the patients in the office is enhanced. In conclusion, creating a patient-centered, results-oriented experience. You have to provide a very comprehensive visit. So when that patient leaves here, they don't feel like they're gypped. They feel like they got their money's worth. They feel like you got enough information to come to an accurate conclusion of what their problem is so that they will stay compliant with the care and get the results that they expect to get and that you expect to deliver. So please go through your process and ask yourself, is that the type of exam you'd want to go through if you went to a chiropractor? Would you be satisfied with your exam? If not, time to revamp. But I would be more than happy to share exactly what we do, why we do it, how we do it, the reports that we give. They're very thorough. They're all evidence-based, phenomenal reports that enhance compliancy, enhance communication with primary care providers, and it gives us a high level of detail on what we're doing and why we're doing it. And by the way, that report also has outcome assessment, percentage disability, all these things where we can measure success.
I wanted to touch on a couple of those things that you mentioned, and I think that from an administrative level. Now, some of you out there are going to have much smaller organizations than we have. We have 30 plus employees in 2 locations. But when you're thinking about some of these things as an owner, it's really important to understand why all of those steps that Jeff talked about are very important for growing and improving the trust of your patients as well as the community that you're in. And so thinking about, maybe you're in a small town or maybe you're in a really big metro area. So if you're the only one in a small town, you don't have any competition, right? People are going to come and see you regardless because you're the only option. But once you have competition and once people have choices, it really is important that you hone in on that connection with your patients. And so the first visit is always that first impression. It's always very important that you develop that connection and relationship with your patients. And, you hear patients and other doctors talk about doctors having a good quote unquote bedside manner. Well, even though we're not, in a hospital setting or whatever it may be, it's still very important for every doctor and chiropractor out there to have a good bedside manner, because that's what develops those relationships with those patients and makes them want to come back. And also, patients who like you are excellent referral sources. We operated for so many years without spending very much money on marketing because we had such a great referral source with our patients that we didn't really need to spend any money marketing. So that's really important, making sure you have a good bedside manner. The next thing that I wanted to touch on was, making sure that when you're educating the patient, which is extremely important, because if you're not telling the patient why you're doing what you're doing, they're going to not trust you, or they're not going to believe you, right? Think about, if you have kids out there, kids are always asking why? And it's really important to give them a reason, right? So if you're educating the patient and you're open about the things that you're doing, they're going to understand why you're doing what you're doing, and they're more likely to follow through with the plan of care that you have for them. Now, keep in mind, internet is a helpful and hurtful thing, right? You can give them information and they might go home and, research what you gave them, but make sure that the information that you're giving them has evidence and has something to back that information, so that if they do come back in and they ask more questions as to why you're doing it, because maybe they read something else out there, you're going to be able to give them a response. Believing in what you tell them is also very important. And I would say for a larger organization like ours, when we hire associates, it's really important that they understand why you do what you do in your clinic, but also that they believe in it. And, I'm going through with my team right now, and we do a book club, and we're reading 15 Laws of Invaluable Growth by John Maxwell. And I came across this quote in his book the other day. I will teach only what I believe. Passion matters. Patients can see. If you don't believe in what you're teaching them and treating them with, they can see it. And they have to believe what you believe. And if you don't believe in what you're doing, it's never going to work, and you're never going to grow. Also, Jeff mentioned finding, something in common with your patients, and something that Jeff and I talk about a lot when we bring in new patients is he always finds something in common with that patient. When that new patient comes in, asks them a lot of, questions, and finds something in common with them. Because if you find something in common with your patients, you have that connection with them and they feel it. But if you don't relate to them in any sort of way, it's really hard to gain that trust from that patient and for them to feel that really warm and cozy feeling when, I guess, they're taking you on as a new provider. And then last, I wanted to mention, don't be a hypocrite. If you're talking to patients about something specific, you want to believe, again, in what you're telling them, but also you want to live that. So if you're a doctor who's maybe overweight or could be obese for that matter, and you're talking to people about maybe the fact that they need to lose weight, it's very difficult for that patient to believe you, right? So always make sure that you're living up to the standards that you're talking to your patients about and expecting them to do, because they can see right through you.
None of us are perfect. There's plenty of good chiropractors out there that are overweight and whatnot. So maybe that's just not one of your triangles. You focus on something that you're good at so that you can teach them. One of the things I wanted to pick up on that first exam, that first visit, is one thing that's super important. If you don't do this, you need to, is when you're done with your exam and you give your recommendations. If the recommendations are on the first day or second day, it doesn't matter. I try to do mine on the first day if I have enough information. If I don't, I wait. I mean, there's so many chiropractic clinics that are like, no, we got to do a second. I do it when I have enough information to do it. Why? Because I want that patient experience to be exceptional. I'm not going to have them wait and bring in family members to convenience my clinic. I'm there to convenience them, the patient. So that's my focus. But when I have my treatment plan, I make sure that that patient knows exactly when we're going to reevaluate our progress. Okay, Kristin, in 10 days, we are going to reevaluate to see where we are. And in those 10 days, I'm not going to be surprised if you feel better before those 10 days. And to be frank with you, I won't even be surprised if you're more sore within those 10 days. But we're going to reevaluate and we're going to measure and compare to where we started. Do you understand that? That way they know. Listen, we're going to keep trucking until a reevaluation. So important to establish that communication and expectations. When we go back and we look at that first visit, starting from collecting the data to doing the, using this technology to measure range of motion, doing their gait scan, again, getting a good verbal history, patient family history, and then going in with the doctor and getting even more information. And you can see how this value is building up over time. If that patient's rushed and it's a quick little thing, bang, bang, out of here, oh, come back and see me for the next 6 weeks, 3 times a week, there's not a whole lot of value there. And to be frank with you, you're doing what everyone else is doing. So, Seven Figure Chiro practice really needs to be obsessed with that patient experience. If you have team members that are, I would say, 30 and under team members, employees, each and every one of them has the ability to be obsessed with the client experience. When you start to lose some of that is when you have all these layers, like different management layers and all that, when people team members don't actually affect the patients, don't see the patients, then it gets a little more complicated. But most chiropractic practices out there are of the size where they can be obsessed with patient experience. And I can assure you, if you are, you'll have a great foundation to a 7-figure chiro practice. So with that being said, that concludes episode 8 of the 7-Figure Chiro Podcast. I appreciate you listening in. Please contact 7figurechiro.com to get any and all information that we use on our first patient visit, from the technology to the forms. I'd be happy to share all that with you. Until next time, keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of 7 Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a 7-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.